In the United States, we have experienced a shortage in primary care providers, and advanced practice registered nurses and nurse practitioners have stepped into the role of providing primary care to patients and helping patients obtain access to primary care in areas that it is needed. What I want my patients to know about having a nurse practitioner as their primary care provider is that I am capable of providing nearly all the services that a physician can provide.
Nurse practitioners have advanced training in human sciences as well as theoretical sciences. This allows them to provide holistic care at the bedside to patients of all ages and all disease states. When faced with the decision between selecting a physician or a nurse practitioner for your care needs, it is important to understand that here at DeKalb Health, nurse practitioners are allowed to practice to the full scope of authority. This means that we are allowed to carry independent patient panels, we have hospital privileges, we take call, and we can manage all of your basic medical needs.
The journey to becoming a nurse practitioner includes a 4-year bachelor's degree in nursing, and then an additional master's degree, which generally is 2.5 to 3 years in length. Typically, nurses will be working in a clinical setting while they're obtaining their master's degree, which is further encouraging their education and also giving them bedside clinical skills that otherwise may have been missed. After you've completed your master's program, you take a board certification and then obtain state licensure as well as prescription authority in the state in which you will be practicing.
My role and responsibilities as a nurse practitioner include providing evidence-based practice at the bedside while incorporating holistic care to my patients. What that means is that I take into account what your financial situation looks like, what your family dynamics looks like. It is a partnership that occurs between myself and the patient and their family. DeKalb Health is different for nurse practitioners because they embrace our role as part of the medical health care team. They work with us to understand how we can help bridge that gap that exists in current medical practice to provide better care to our patients and our communities.
In the state of Indiana, advanced practice registered nurses are required to have a collaborative physician in which they can go to for support and resources and questions, and the collaborative physician also reviews 10% of the advanced practice registered nurses' charts. I think the best part of my job is being a part of the lives of my patients and watching their families grow, being a part of big and exciting events, and being a part of something as precious and important as their healthcare. We're all here to achieve the same goal, and that is to take the very best care of patients that we can.
You can feel comfortable with your choice of a nurse practitioner here at DeKalb Health.